Hello and good afternoon, everyone. My name is Matthew Terry, and I'm an advancement manager here at CSG. As we begin today, I would invite you to put your state into the chat so we just know where everyone is joining us from. But I'd also like to welcome, it is my pleasure to welcome you as we continue to celebrate Innovation Month here at the Council of State Governments. We hope you enjoy and learn a little bit from today's programs and make plans to join us next Monday as we complete our series that has discussed a broad range of topics from healthcare to finance. Today's Innovation Classrooms, Multivitamins, How to Leverage Science and Data to Transform Health and Wellness is brought to you by GSK Consumer Healthcare. And now a few reminders. Before we begin, this session is being recorded. At the conclusion, or in a few days, I should say, it will be available on the CSG website. As you will note, only speakers are able to turn on their cameras and speak today. We encourage audience members to type questions that arise at any point during the presentation into the chat. And you can also direct them to me. Again, I'm Matthew Terry with CSG, or to everyone in the chat. We will address them following the presentations. And finally, I am pleased to introduce today's speakers. First would be Ms. Alpa Shah, who is the medical lead in U.S. Wellness Medical Affairs at GSK Consumer Healthcare, and Ms. Dina Likens with GSK Consumer Healthcare State Government Affairs. Thanks to you both for participating with us today, and I'll turn the program over to you.
Thanks, Matt. So I'm Dina Likens with GSK Consumer Healthcare. I just want to do a quick introduction about the company and then hand it over to the expert Alpa. Although I do want to say, I want to give how much I love CSG. CSG was my first job out of college. I was a research assistant there. And so I know what a valuable role they play for policymakers and staff. And so I'm always happy to participate in any of their sessions. So GSK Consumer Healthcare, right now we are one part of the larger GSK, which you probably have heard of, is traditionally known as a pharmaceutical company. And that is correct. There's pharmaceuticals and HIV and cancer drugs, and then there's us. So we produce about 25% of all of the over-the-counter medications and medicine in the globe. Come July, we are spinning off from GSK. We will be starting or being a standalone consumer healthcare company. We'll go by the name Haleon. It's now completely official. We have known for some time, but we are now able to talk about it. And we're really excited about it because not that GSK hasn't been, and they do enormous things, but this way we can focus just on the area of self-care. And we're very excited about that because as we saw during COVID, we need to look more and more about how people take care of ourselves. We need medicine, we need doctors, but we need people to be fully engaged and informed in their own care because no one knows better about how you feel than you do. And so we always joke, I'm like, you can point to a part of your body and we will make a product that kind of helps with that. We're known for Advil, Tums, Theraflu. But today we're talking about multivitamins, which is one of my favorite areas that we make. We make Centrum, we make Emergency. And that is because, it's kind of preventative medicine. And it's one of those areas that I didn't always take multivitamins my whole life every day. It's the more you learn about it, the more you see the value of it. It really is one of those areas where we as companies need to educate people better about them, and individuals need to learn more about them. So we're doing a lot of exciting science around multivitamins. And there's, a lot of opportunities for states to look at these and how you can better use them. And so I'm going to pass it off to Alpa to talk more about what's going on in the science, and just excited to have you guys learn about what we're doing. Thanks.
All right. Thank you very much, Dina. I am going to go ahead and just pull up my slides here to share with you all. Give me 1 second, and here we go in presentation mode. All right. Okay, so thank you, Dina, for the overview of who we are as GSK Consumer Healthcare, soon to be Haleon Consumer Healthcare. And, I'll start off by just giving a little bit of an introduction on myself. As Matt said, I lead our U.S. Wellness Medical Affairs team for GSK Consumer Healthcare right now, which means I have responsibility for all of our nutritional and more specifically dietary supplement portfolio, including the brands that Dina spoke to, Centrum, Emergency, and we do have a number of other ones in the US and then globally as well. So my job and my team's job is really to look at the science behind those supplements, the data around the health benefits of supplementation, and the reasons that they're needed in the population, and then make sure that we are then accurately communicating that to individuals and the population generally so that they can take better care of themselves. I very much believe in what Dina spoke to, which is empowering people to take some of their everyday health into their hands and being able to have the knowledge to be able to make some of those decisions, and of course talking to their healthcare professionals as well. But there's a lot that people do themselves and making sure they have the info around that. So just a little bit of background on myself. Like I said, I'm at GSK Consumer Healthcare. I've been there for 12 years in various scientific and medical roles, and prior to that, I spent over 10 years in clinical practice as a registered dietitian nutritionist, working with a variety of patient populations from pediatric diabetes all the way to kind of long-term care and nursing home care. So I kind of have done the gambit in the clinical space, as well as I spent a number of years also teaching clinical nutrition applications to healthcare track students, wanting to be dietitians as well as med students and everything in between. So I love kind of having that background and then being able to bring all those different perspectives to what I do today. So with that, I'm going to kind of go through some of the objectives of the presentation today. I'm going to spend a few minutes up front just kind of emphasizing and reviewing things that you may know. I'm sure you've all been exposed to in the past through high school and college and just reading on the internet, right? The importance of essential vitamins and minerals in health and wellness. But I want to kind of make sure we all have the same understanding as we then talk about the data around multivitamins. And then I wanted to also make sure that we discuss what are some of those nutrition deficits in the U.S. diet and how that then relates to multivitamin use. Talk about some common deficiencies and inadequacies of vitamins and minerals, and then specifically in at-risk populations. And then lastly, talk about the role and the value of multivitamin, multimineral supplementation for addressing those critical nutrient gaps. And again, more so even for populations that have greater risks. And around that, I wanted to introduce, our goal today is really to introduce some new information that we have on the value of vitamin and mineral supplementation, with the intention to kind of give you a little snapshot into what we're seeing. Sorry. Okay, here we go. So as far as just kind of a little bit of background, Nutrition 101, what are nutrients and what are foods, right? So pretty much everything we eat falls into this category on the right-hand side of macronutrients. You have carbohydrates, proteins, fats. Those are the things that give you calories, give you energy. But then what you have on the left-hand side there are micronutrients. These are things that actually help you use your macronutrients. So just by ingesting carbohydrates, you don't extract the energy out of those carbohydrates or through fat or protein. You need the action of multiple vitamins and multiple minerals that play roles. Again, they're really small, but they very critical roles at the cellular level, which then convert the food that we eat into energy, whether that's stored energy or energy for immediate use. So deficits in any one of the vitamins that are listed here, the fat-soluble vitamins, the water-soluble vitamins, or any of the minerals here in purple, will have an impact on how optimally your body is able to utilize the fuel sources that you put in. And that then over time manifests in different ways, right? So we're going to talk about that a little bit as we move on. I didn't want to forget water because it's also another critical component of overall nutrition, but does not necessarily provide calories or vitamins and minerals, although you may get some through your water consumption depending on your water source. Okay, so when we talk about vitamins and minerals, we talk about being essential. So there's 13 vitamins and 14 nutritionally essential vitamins and minerals. And when I say essential, I just want to clarify what I mean by that. It means that these are things that your body cannot make. Your body must obtain these nutrients, these 13 vitamins, these 14 nutritionally essential minerals through dietary means, right? So whether that's through the diet or supplements or fortified foods, you must consume them. You need them to survive, but your body does not make them. The only exception to that rule is vitamin D. Vitamin D is something your body can synthesize on the skin when you're exposed to sunlight, but there's a lot of variation on how much people can actually make. And essentially it ends up being that people do not make enough because of things like pollution in the air, because of where you live in relation to the equator. The use of sunscreen is a major factor in people's ability to actually make vitamin D. So essentially, pretty much everything you need, you've got all these vitamins and minerals, you need to be able to get them through your food intake or through supplement intake. So like I said earlier, micronutrients, vitamins, and minerals do not provide calories, but what they do is help convert the food you eat into energy, and also they're critical for multiple biological functions. So serving as cofactors of enzymes, making hormones, being structural components of your bone, right? So calcium, magnesium in the bone, giving it the strength that it needs, as well as serving as antioxidants in the body. And I'm not going to go through everything, but this just kind of gives you a snapshot of all of the different functions that micronutrients are involved in. And so what happens when you don't have them, right? So lack of micronutrients can result in both inadequacy and deficiency. And yes, there is a difference between the two. Inadequacy is not getting the optimal levels, but not being so low that you start showing clinical signs of deficiency. However, inadequacy can still affect how your metabolism works. It may not work as well. It may impact growth and development. It may impact how your immune system works. It will still work, but it may not be optimally. It may affect how your brain works, right? So your cognitive functioning, how your eyes operate, your vision, your bone health. So lack of micronutrients and even just small deficits in that can have impact on optimal functioning of all of these biological functions in the body. Deficiency is probably what people are more familiar with, right? So we think about deficiency as it relates to vitamin C back in the 17th and 18th century, and scurvy that killed those out at sea because they were only eating fish and did not have any fruits and vegetables in their diet. People may be familiar with things like vitamin D deficiency and the effect of softening of the bones, or iron deficiency and anemia that you do commonly still see in some populations. But those are kind of more overt and clinical manifestations. And the goal is to avoid both inadequacy and deficiency, right? We want to be able to identify when inadequacies are starting to exist or present themselves so that they don't progress to deficiency. So then with that, I wanted to start talking about where micronutrients come from, which is from the diet. And so how are we as Americans doing when we think about dietary intake? And so as we think about dietary intake of the US population, and we look at the dietary guidelines from 2020, in the context, dietary intakes in the US, in the context of kind of grading them with a healthy eating index, which is on a score of 0 to 100, kind of like a test you would take in school. We're not doing so great when you look at these scores, right? We're barely kind of right in the middle there in the 50s. You've got a couple of groups, the young and the older age groups that are represented on this chart that break the 60% mark, but otherwise we're in the 50s. And so when we translate that to kind of like a grade on a test, we're kind of in the F range. We're not doing so great. So there are lots of opportunities in optimizing nutrition of Americans through multiple avenues, and micronutrient intake is one aspect of that, which is what we'll dive into a little bit more today, and then how that then relates to the benefits of vitamin mineral supplementation or multivitamin supplementation. But as I looked at this chart as a nutritionist and having worked with multiple age groups, like the first thing that stands out to me is looking at those first 3 decades of life, right, where growth and development, and particularly skeletal growth, is so important. You only build bone mass in the first 3 decades of life. And so if in those decades of life we have people scoring in the 50s, right, as it relates to kind of their overall intake and how they're doing based on recommendations of healthy eating, that doesn't set us up for success as we think about health outcomes later in life. So that one it sort of very much stood out to me as I think about when it's so critical to get some of these key vitamins and minerals. Okay, so building a little bit more on where the dietary gaps are as we look at dietary intakes, right? And we look at average dietary intakes in the US population. This is also some data from the US dietary guidelines from USDA and HHS. And if we look at this chart, it's really interesting. The purple or the lavender bars are indicating intakes of different food groups and then subcomponents of those food groups that are actually meeting recommendations. And then the blue bars are not meeting recommendations, or in percentage of the population that is below the recommended intake. And the longer the line, either way, the greater that percentage of the population. So if we look at the purple, the only places where you really see us doing well and meeting recommendations, which is a recommendation you don't want to meet, is refined grains. So in general, Americans are doing okay in meeting total grain intake, but that's largely driven by refined grains. And then same thing even with total protein food. So that's over here, the total protein, and you will see that that's also driven by probably not the healthiest of proteins, where you see seafood kind of being very low, but you see other proteins such as meats, poultry, eggs being a little bit higher. So that's sort of how we're doing. And then when you look at the bars underneath, you see vegetables, fruits, whole grains, seafood, all of the places where the foods that are nutrient dense that will give you those vitamins and minerals are all significantly below where we'd like to be, with greater than 80% of Americans having diets that are low in fruits, vegetables, and dairy, which are key contributors of those important nutrients. So what does that mean from a vitamin mineral perspective? The dietary guidelines for Americans of 2020 identified calcium, potassium, vitamin D, and dietary fiber as nutrients of public health concern, because those were nutrients where there were great deficits in dietary intake, and those then were associated with poor health outcomes, right? So as we think about calcium, the link to bone and osteoporosis, or the risk of osteoporosis. When we think of potassium intake, not having adequate potassium intake in relation to the amount of sodium that we consume as Americans is linked to adverse cardiovascular outcomes. Vitamin D is one that across the board, everybody is pretty low in, and it's not just the US, it's a global epidemic. And that is a nutrient, like I mentioned earlier, you really do need to get from either fortified food or from a supplement. You just cannot get enough through diet. There are not enough natural food sources and not enough in those natural food sources for people to reasonably consume all of their vitamin D requirements through food. The list goes on. So there are specific nutrients of concern for specific populations. For infants, adolescents, and premenopausal women, there's iron. For women of childbearing age, folic acid, and I'm going to talk about that a little bit more in detail, as well as iron in pregnancy, and then also older adults, and the importance of vitamin B12. So I'm going to get to all of those in a little bit, but I also want to highlight, in addition to these that were called out as nutrients people were not getting enough of, and that's linked to poor health outcomes, there were other underconsumed nutrients that people just weren't getting enough of, but we just don't have all the data to quantify the health impact of that. So Americans also are under-consuming vitamin A, C, E, K, magnesium, and choline in relation to what the recommendations are. So it's broad spectrum. There's a lot of things that we need to be able to fill the gap on. I want to take a moment just to talk about populations that are at risk for micronutrient inadequacies and deficiencies. So these are those at-risk populations that I was talking about earlier, right? And so some of them were broadly defined in the dietary guidelines, but there are others as well as you look at the scientific literature. Some of them, like I said, that were in the dietary guidelines: women of childbearing age, pregnancy, lactation, women in relation to calcium, vitamin D across the board, older adults with B vitamins, as well as a number of other nutrients. And then there's also other populations, right? So as we think about those with darker colored skin, or those that use sunscreen and or are covered, there's a risk for vitamin D deficiency. There's people with low socioeconomic status. There's data showing multiple micronutrient deficiencies in those populations. People who have issues of absorption, right? They also then have issues not just absorbing food, but the nutrients that are within those foods. And there's more. So there's data showing multiple micronutrient inadequacies and deficiencies in patients who are obese, or those who have had bariatric surgery. These are multiple nutrient deficiencies, right? So even though caloric intake may be in excess of what is needed, those calories are sort of like empty calories. They're not nutrient dense. So they're all of the cellular, the functioning that I was talking about earlier, where those vitamins and minerals are important to make sure everything's happening the way it's supposed to in your cells. That's what's not happening in these situations. People may look on the outside like they may be healthy or, are getting enough food, but that doesn't necessarily translate to micronutrient adequacy and health. There's one, and I guess the other thing I really want to point out here, and vitamin B12 is a really good example of this, especially in older adults, is just like diabetes and cardiovascular disease, which take years and years to manifest, right? It's years of poor dietary intakes, other poor lifestyle factors, as well as genetic factors that all kind of come together over a number of years, resulting in disease. Micronutrient deficiency is very similar. Just by not getting enough, for a short period of time, you may not end up with a overt clinical deficiency, but years of it will result in some significant impairment if not identified. So vitamin B12 is the perfect example where your body can store, like an average adult has about 3 to 5 years of adequate stores of vitamin B12. So if today I stopped consuming all vitamin B12 in my diet, I would have about 3 to 5 years of stores that would pretty much allow me to continue to function without showing signs of deficiency. But at some point I would start showing those signs of deficiency. And for something like vitamin B12, where it's not just anemia, but it's also neurological impairment and irreversible neurological impairment, it could be pretty significant impact on a person, right? So it's just important to keep in mind that some of this stuff happens over long periods of time, and identifying ways to get the population to have, better eating habits, as well as other ways that we can help people to meet their nutritional requirements, because there's so many places where you can miss, right? Multiple nutrients for multiple populations. It's incumbent, as we think about healthcare, to think about what are some of those solves that may help people to meet those needs. And then with that, then let's talk about what some of the potential solutions would be. And my role today here really is to talk about what a multivitamin, multimineral supplement will do or could do. There's a lot of supplements on the market. I'm sure you've all walked into a pharmacy or a supermarket and walked down the aisle with all of the supplements. There's a lot of different supplements there. But when we talk specifically about a multivitamin, multimineral supplement, we're talking about kind of a broad spectrum combination of containing the majority of those essential vitamins and minerals. Every product on the market is different, but essentially it is a combination of multiple vitamins and multiple minerals. And the solution is not just the vitamin and mineral alone. It really is along with a healthy and a balanced diet. So, I want to make that point and stress that point. We as a company, our position is always, along with many other scientific organizations, is aligned with promoting healthy eating and food first. But we also recognize that there really hasn't been much change in dietary patterns in the US since the first dietary guidelines came out in the 1980s, right? So every 5 years, there are guidelines. Those guidelines are very similar in what they identify as nutrient gaps. And we haven't moved the needle. So how do we, what are other ways besides, encouraging dietary changes? What are other ways that we can think about helping people to move a little bit closer to wellness? Okay, there we go. So I wanted to just share a little bit of data from studies that have looked at dietary intakes of vitamins and minerals in the US and what impact a multivitamin mineral supplement can have. So this is some data from the National Nutrition and Health Examination Surveys from 2009 to 2012. This is in US adults, so 19 and older, looking at their dietary intakes of some key nutrients that we know to be suboptimal in the US diet, and looking to see when people are consuming a multivitamin versus consuming no supplements, what's the difference in their ability to achieve the recommended intakes. So if you look at the dark green bars and the light green bars, that's multivitamin use. Dark green is 25 plus days a month of somebody consuming a multivitamin. The light green bars are 13 to 24 days. And then the yellow bar is 1 to 12 days of taking a multivitamin. And then the red bar is the red bars are no multivitamin use. So if we look at this, you can see the green and the dark green and the light green both are getting you closer to meeting 100% of needs of vitamin D, of calcium, of vitamin E, vitamin K, magnesium, vitamin A, C, and zinc. And you can see the red bars across the board for each one of the nutrients. The difference is different across the different nutrients, but you can see consistently in this chart that in the red bars are much lower than those that are taking the multivitamin supplement, even a little bit. We did some work a couple of years ago. GSK Consumer Healthcare did some work looking at this data looking at NHANES data specifically in the 50 plus population and wanting to see if we saw similar results as it related to non-users of multivitamins versus more consistent multivitamin users. So this chart's a little bit different in that you're not trying to get to the 100% because this is looking at the percentage of the population below the EAR or the AI, which is just below the recommendation, right? So the percentage of the population below the recommendation. So we want the majority, we want people to be as close to the zero as possible. And when we look at this data, the multivitamin non-users, so people who did not use a multivitamin, had higher bars, especially for vitamin D. So you can see for vitamin D, over 90% of those who did not use a multivitamin fell below meeting their recommendations for vitamin D. So that multivitamin significantly helps. And in that case, you can also see here that cut in those that were using a multivitamin greater than 16 days per month, they significantly cut the percentage of the population that was below the EAR, or the recommended levels. This chart shows data from 51 to 60 years of age, but we also saw very similar results as we looked across 60 plus or 61 plus as well. So again, just another proof point around the fact that when people use multivitamin supplements and when they use them more consistently, so greater than, half the month, you will find a significant change in intake and getting closer to meeting their recommendations. So, I've been talking a lot about what nutrients people don't get enough of and why and how a multivitamin may help close some of those nutritional gaps. But what I also want to make sure I highlight to you then is, what is the health impact of closing some of those vitamin mineral gaps, right? Because at the end of the day, we want to be able to see what does that mean from a healthcare perspective, and how does this really move the needle in improving the health of our nation and the health of Americans? So as we look at components within a multivitamin, things like folic acid are incredibly important as we think about women of childbearing age, and we think about the prevention of neural tube defects, birth defects that can be very, very detrimental, and just not something any family wants to deal with. So when we look at the impact of folic acid, we have seen in a variety of studies that 35 to 75%, there's a decrease of 35 to 75% of neural tube defects when you have folic acid within a multivitamin and food folate is consumed. And for this reason, there's a number of health agencies that recommend folic acid supplementation for women of childbearing age, as well as during pregnancy, including the CDC and the U.S. Preventative Services Task Force. Another critical nutrient during pregnancy is iron. Iron is a very important nutrient and very difficult to get in the amounts that you need to meet pregnancy requirements. So this is a nutrient where the nutritional requirements increase significantly during this life stage for women. And it's hard to meet that through diet alone. You just can't. And the increase is because of the fact that the fetus needs to be taking in the extra iron, as well as, if you think about pregnancy, the expansion in blood volume of the mother necessitates having a lot more iron in the system. And so the combination of those two, it's an increased burden on the mom. And if they're not able to meet those iron recommendations through diet, supplementation is necessary. And actually, there's some data around that I'll share, but I wanted to also share here that iron deficiency, it has been shown to be associated with low birth weights, preterm deliveries, and other adverse maternal health outcomes, as well as fetal health outcomes. So it is another important nutrient that can be addressed with supplementation. And so just some data here around the impact of supplementation. And I'm sorry, I have to move something around so I can see my own slides. Okay, here we go. So without supplements, 80 to 95% of women don't meet their iron needs. And over a third of women will fail to meet their folic acid recommendations. So just with a prenatal or a multivitamin, you're meeting needs that can address some significant health concerns. And for that reason, the American College of Obstetricians and Gynecologists in the US recommends a daily prenatal to meet those multiple vitamin mineral needs. And it's not just the iron and the folic acid that I talked about, which are critically important because they really affect pregnancy outcomes, but there's also iodine, which can have a significant impact, vitamin D as well. So there's other nutrients that are inadequate during pregnancy that a prenatal can cover. In addition to women of childbearing age and pregnancy, calcium and vitamin D is also something across the board that is important for all individuals, but especially as we think about women because of their risk for bone loss postmenopause, and then also as we think about older adults and the risk of falls and fractures and frailty, getting adequate amounts of calcium and vitamin D from supplementation is important. And then lastly, I just want to address B vitamins in older adults. And I talked about this a little bit earlier with vitamin B12. There's also other B vitamins, but vitamin B12 specifically has been called out in the dietary guidelines for Americans multiple times and in the scientific literature as something that really needs to be paid attention to for multiple reasons. One being the fact that as people age, their ability to absorb vitamin B12 from food sources decreases. So their body is unable to kind of break apart the vitamin B12 from food in their stomach, and hence they actually don't absorb what they're consuming. So supplemental forms and fortified food forms actually are better because they kind of bypass that that issue that older adults have as their physiology changes, their stomach physiology changes. There's also this issue of polypharmacy in older adults, or older adults are taking lots of medications that may have a negative effect on the status of their B vitamins, and particularly things like acid reducing medications, diabetes medications like metformin. They deplete the body of vitamin B12, and so knowing the impact of that, in addition to the physiological reasons why older adults may not be getting adequate amounts of B12, it's even more important to make sure that there is, if not through diet, then through supplementation, a kind of insurance in getting all of these nutrients that have been mentioned as important for older adults and across the population. So the what's new that I want to make sure I talk to you guys about. So as a company, we've had Centrum Multivitamins since the late 1970s when the brand was launched as Centrum, and have participated in a number of clinical studies supported by the NIH over the years. And we've provided product to really advance research in the area of multivitamin supplementation and health outcomes. And one of the most recent studies that we have supported is called the Cosmos Mind study. It was supported by a grant from the National Institute of Aging. Our company provided product for this study. It was solely conducted by Wake Forest University investigators, and that data, the full data is still forthcoming from this study, but initial results were presented at the 14th Conference on Clinical Trials on Alzheimer's Disease at the end of last year in November 2021. And some of the findings that were discussed during that meeting were around the benefits of multivitamin use in slowing cognitive decline. Could taking a daily multivitamin actually delay cognitive decline in older adults? And the data was pointing in that direction from what was reported by the investigators at that conference. Subsequent to that, there was this month in a newsletter from the Center for Science for Public Interest, there was an article on this study, on the Cosmos Mind study, speaking to the outcomes, interviewing the lead investigator, and speculating around what why they were seeing some of the benefits that they were seeing around cognitive decline and the benefits of multivitamins. So I've got the links here. I know we're going to share some of this information with you post-session, and the links will take you straight to the articles as well as the abstract from the conference to look at the data more in detail. We are unpackaging this data as it comes out. Like I said, we have the initial results and some of the initial read. We're waiting for the full publication to come out and hope to come share more in the future. But this is something that definitely is exciting as we think about, you know, the data that has evolved over time on really showing the health benefits. I talked about the neural tube defects and iron in a different population. This is really interesting as we think about an older population. And so we're going to be watching this and sharing as we learn more, as more data comes out. But I want to just end with kind of speaking to why cognitive aging is such an important consideration as we think about multivitamins and the value that multivitamins may bring to older adults in the U.S. We know, and I'm sure you hear this all the time, that the population is aging as a whole, right? So as we look at 2019 and we look at 2060, we can see almost double the number of persons that will be age 65 and older. And that means that we need to pay attention to the health of older adults and how do we help people age in a more healthful way so that they can have more healthy years. And we can also reduce healthcare costs. And one of the things that I found interesting as I looked at this study around physical functioning of older adults, those that were, it was a 2019 study where 65 people over the age of 65 or older were asked about some of their physical functioning difficulties, and 27% of individuals reported difficulty with cognition. And so this is an area where there may be a potential in addition to diet, for multivitamins to have a place in ensuring adequate nutrient intake that may be beneficial in the long haul. Some of the interesting things around cognitive decline and aging is that it can be from multiple reasons, right? It could be that it's one of the B vitamin deficiencies actually manifesting as impaired cognitive function, or it could be something of disease-oriented or of pathological origin. But if we can intervene on the nutrition-related effects, then that's one place where we can make a difference. And this, for me, speaks to the idea of health span versus lifespan. We want people's lifespan and their health span to be as equal as possible, right? The number of years that people live and have the functioning that makes them feel good and they don't have difficulty, and increasing that health span is what we're aiming to do with improved nutrition across the board. And I will end with just a few quotes that just, again, highlight that we want to make a impact where impact matters. So healthy lifestyles have the potential to decrease cognitive decline. That's healthy lifestyles across the board: diet, exercise, supplementation, all of that considered. So it's something we should pay attention to. Data has shown that. And then approximately 2 out of 3 Americans experience cognitive impairment at approximately 70 years of age. 2 out of 3 is a lot. So again, this is somewhere where we may be able to have an impact. And lastly, I just want to mention the fact that when we talk about cognitive decline in aging, that burden is even greater as we think about minority populations and those with lower educational attainment. So again, a place where we definitely want to be able to make an impact if possible through nutritional interventions and strategies. And with that, I will stop talking. Thank you all for listening.
Well, thank you, Alpa. You have me convinced, I think, like Representative Ryu, that I need to go out and get my vitamin D supplements and some others. So I look forward to that next shopping trip. But thank you all, or thank you for that again. And I would encourage, we have a few questions, but I encourage audience members to type in any questions or comments into the chat, and we're happy to share those and discuss those. I have one here, and just kind of sharing this, Dina, this may be a better question for you to kind of step in and help with, but how can policymakers use this for better health outcomes and cost savings as they think about working in their states?
Yeah, thanks, Matt. I mean, that's the exciting part of all of this. I think all of us deep down probably knew, like, okay, vitamins are probably good. When you really look at the specifics and the specific populations that are being affected, and in a world where, I was just at a Tufts nutrition policy school event where we talked about, no one wants to not feed their kids healthy food. It's just a matter of time or money or knowledge, or even people about what they eat. And so seeing this, it's like, it's a matter of, in some ways, no matter how much you work on this, if you have all the money you need, the data now shows you're still not getting the vitamins and minerals you need. And when you look at micronutritional deficiencies, you might get what you need on a Monday, but not on a Tuesday or Wednesday. And so you start to see that there's all kinds of policy implications. And you look to, and as you know, like when we show, when I got into this area with this working with GSK, of like, well, how come, how come I didn't know this? How come, everybody doesn't know this? And some of this is like, well, the self-criticism of the industry was that we didn't do enough clinical trials. We didn't do enough blinded, randomized studies. And so now, as you can see from what Alpa shared, like we are definitely going down this road to show what we always knew. So as far as, kind of policy ideas, I mean, it's endless. Like you could look at health insurance coverage, private health insurance coverage for multivitamins for childbearing age, because you look at, like an issue like spina bifida, which many states look at. That is people who, that is a very, not only horrific disease, but a very costly disease, right? So it's something that, like, that, making sure that people are, offering vitamins to women of childbearing age, because most women, when they find out they're pregnant, start taking vitamins. But the issue that happens is when you're of that age before you get pregnant, and so it's before you knew you were pregnant, kind of thing. That's one thing. You could look at Medicaid coverage of vitamins. Most states do not cover vitamins under Medicaid. You could look at a very touchy topic, but one that probably needs to be discussed, is that SNAP benefits for vitamins, because the issue is, historically, as a society, we've looked at making sure that people have enough calories, and it absolutely is true. But if the person gets their 3,000 or whatever number of calories, but if all they had were Twinkies because that was on sale at the dollar store, then they're going to have some health issues currently and down the road, as Alpa showed. So there's other areas within the government's control of funding that could use stuff like this, like prisons. We all have read plenty of articles about the diets that are provided to prisons. And we understand that, like, while that population is that's usually, what I've read, is like the third most expensive population as far as healthcare costs for a state. So just inserting something as easy as vitamins or dietary supplements into a prison population could help with health outcomes and healthcare costs. With the new cognitive decline data that's just coming out, you could look at nursing homes and assisted living facilities. And I mean, I know Medicare is a federal benefit, but the states are very active in the aging population. So really, the sky's endless. So I think it's a discussion we'd love to have, further with anybody who's interested, but we're really excited about the data that's come out and the historic data that we just feel like we need to highlight more. So thanks, Matt.
Yeah. And then we had a question, you kind of answered it a little bit in the chat, just give you a quick second or a quick minute to make sure everybody kind of heard and understand. But Representative Ryu had had the question of, I'm concerned about organized retail thefts and supply chain fidelity for internally ingested products, such as over-the-counter vitamins, supplements, and even baby formula. If they are stolen from stores, shelves, and fenced online, how will GSK and other manufacturers be able to assure quality of products and protection of brand?
Yeah, happy to talk about it. It is an issue that I've been working on in a number of states. And from our perspective, to be honest, we're less concerned about stolen products and more concerned about counterfeit products that are coming in from other countries and being sold. The number one counterfeit product that we're finding right now in the US is Centrum for kids. And that's a scary thing because you're right. So we have extensive tests that we have to pass with the FDA about shelf life, about, child resistant packaging, obviously what's in the drug. And when it's a counterfeit product that is sold online, we we have no idea what's in that product. And so what we've been doing is working with our retail partners and working with states, because what we're seeing, this explosion of this issue is due to kind of the movement of the society to buying more things online. And we feel this trust. And they have done a good job. We have developed a trust for online marketplaces, and then we feel like we can buy things. And what the legislation is typically doing is really just trying to treat that online seller like a store anywhere, so that they would have to be able to provide their business address and email or contact information, so that if there was an issue, that a buyer, like you would be able to at a brick and mortar store, would know where to go. So I'm happy to connect with anybody else who's interested. And yeah, there's plenty of counterfeit and stolen products, because even if it's stolen, there's usually a shelf life. And so it could be past the expiration date. And so there is model legislation, and I'm happy to work with anybody to make sure they see it. And Matt, in fact, I'll make sure you get a copy of it as well to pass along, and I will connect with, the representative as well, just to make sure she has the bill as well. But there's a coalition of retailers, and we're part of that to work on that, because we're equally, fearful, because we go to a lot of effort to make sure that our product is safe. And so it's a very scary thought to think that there are times where people think they're buying our product and they're not.
I appreciate that. And so I appreciate everyone for tuning in. And as Dina said, we will share more information here on the some of their information programs. If anyone has any wants further information, happy to reach, or if you want to reach out, happy to connect you with her or anyone on the team over there at GSK. But I hope you all will join me in thanking our sponsors, our speakers today, Alpa Shaw and Dina Likens from GSK Consumer Healthcare. And further information on their mentioned study of vitamins will be available soon. And as I mentioned in our opening, in the coming days, this session recording will be posted on the CSG website on the Virtual Innovation Classroom registration page. And to conclude our series next week, we will have our final two sessions, Understanding Smart Finance and Enabling Bright Financial Futures, presented by Security Finance, and Retirement Security and the Future of Work, presented by the National Public Pension Coalition. Thank you all again for tuning in, and we will see you next week as we close out Innovation Month here at CSG.